morning. Sorry about the time change today. Tomorrow we'll be back at 2:30, and then every day thereafter at 1 o'clock, the regular 1 o'clock. I hope everybody had a nice weekend. The weather was nice. It was an opportunity to be outside, hopefully, and we're going to go through the data now. I'm going to give you an update on the weekend, but in general, it's all good news. Everything about this weekend, it is a good news story. So I want to begin by thanking everybody in Rhode Island for following the rules and doing everything that you can do to keep yourselves and your families safe. The data is coming up on the screen. We'll begin, as we always do, with the data. And again, it's a good news story. We're seeing plateau, very stable situation, which is a great thing. We started our phase one a few weeks ago. We haven't seen any real spikes or increases, so everyone should be starting to feel a little bit more confident that we're learning to live with the virus. And it hasn't gone away, it's still here, but we're learning to live with it, and the data on your screen should give you some confidence that we're making good decisions and we're learning how to live with it safely. Having said that, you know, it's been a really difficult 10 weeks for everybody. And at this point, the cumulative loss of life in Rhode Island, we've lost more than 600 Rhode Islanders to the virus in the past since we've started. And I just want all of us to be mindful of that and realize that there's a lot of suffering right now. So I will say, as I say every day, just be kind, be patient, be empathetic, and be aware of the pain and suffering that's happening around you and around us in our community. Excuse me. So, as I said earlier, I want to thank you all for following the rules over the weekend. I have checked in throughout the weekend with the state police, with the Department of Business Regulation, with the Department of Environmental Management, and the good news is overwhelmingly, people were out and about doing the right thing. You were out in the parks, but you were socially distanced. We didn't have to really break up any large congregations to speak of. You were out shopping, you were outside dining, but you were wearing your masks, you were keeping socially distant. A few folks went to the beach yesterday. Mother Nature helped us out a little. There were no crowds to speak of at the beach, but it was also not a 90-degree day. So it's allowing us to ease into our summer. I want to again thank the folks at DEM. We were prepared for thousands of people to show up at the beaches. Instead, hundreds of people showed up, but we were ready. And those of you who went to the beach had a good time and followed the rules. This weekend, DBR, Department of Business Regulation, surveyed over 200 businesses. They found 98% compliance with mask wearing among employees, 97% of mask wearing of customers. That's fantastic. That's essentially full compliance with mask wearing over the weekend at the couple of hundred businesses which they inspected. I want to point out that's better than it's ever been. That is better than last weekend, better than the weekend before. It means we're getting better at this. As I've said from the beginning, it's don't fight the rules, you know, follow them. Don't look for ways to get out from under pushing the limits. The better, we will all be better and safer, and more of us get back to work and out to dinner and shopping if we follow the rules. So I want to give a big thank you to all the business owners and all the employees who are following the rules. I appreciate it. I think it's fantastic. I also want to report that we now have over 35,000 people who have downloaded the Crush COVID app. If you haven't done it, please do it. It takes less than a minute. You can go to Google Play or the App Store and just download Crush COVID RI. We have more than 35,500 downloads so far. That's fantastic. Also, you're continuing to give us feedback, which is very helpful. We want to make the app better. This is a version 1. We'll be rolling out a version 2 in a few weeks. So you download it, use it, let us know what you like, and let us know how we can make it better. Some of you I know are still hesitant. You're afraid someone's going to get your data. You're afraid someone's going to be tracking you. Even though that is not true, I'm asking you to just try it. Just please download it, try it for a week or two, and decide if it's something that you can comply with. The more people we have using this app, the better we can be with contact tracing, and it'll just make everybody safer. I want to say a few words about mask wearing, about being outdoors, and about general compliance. So it is my intention, hope, and plan to start what we're calling phase 2 next Monday on June 1st. That is going to be a reopening of almost every part of our economy. Restaurants, hairdressers, gyms, churches, really offices, more manufacturing, all of our beaches will open. It's going to be a big portion of our economy coming back online. Now, I am excited about that, and I am 100% confident that we are ready and we can do this safely, and I want to share that confidence with you. But it's going to be even more important to follow the rules. So we want you to go next week and get your hair cut and go out for dinner and reopen your business and go back to the gym and go to church or worship or mosque or synagogue. That is all good. That's where we want to get. But as we start to see the bigger reopening, I need you to follow the rules even more. Because what we're going to learn together is how to drop our kids off at childcare, allow our kids to go to summer camp, go to the beach on the weekends safely with the new rules. So what are they? Avoid large crowds. Avoid being close to people for a long period of time. We're learning more about the virus. We know so much more now than we did 10 weeks ago. And now we know big crowds are the problem. Close with somebody for a long period of time is a problem. Please do not go out if you're sick. If you have the sniffles, if you have the fever, if you have any symptoms, take a day off, stay home, get rid of your symptoms, call your doctor, get tested if you need to. Wash your hands constantly and obey the social distancing. So I want to take a minute to talk about mask wearing. For many people, it still feels a little strange. I understand that. It is different. It is a little strange. However, it's effective. It's inexpensive. It's easy to follow. It's effective. And it's going, if everyone does it like we did this weekend, it's going to allow us to continue reopening our economy. So if you're one of the folks who's just made it part of your new routine, thank you. If you're still struggling with it, I'm asking you to just make it a part of your life. You know, like you wouldn't think of leaving your house without your purse or your wallet or your phone or your keys. So do the same with your mask. You know, whatever routines you're in every day, add mask wearing and putting a mask in your pocket or your bag to that routine. That's what I'm asking you to do. Why is it such a big deal? You know, people have said to me, well, why do we have to do it, Governor? A simple cloth face covering won't protect us from getting sick. That's true. That is true. I don't want to create that false sense of confidence. A simple cloth face mask is designed to help you from spreading the virus, if you have it, to somebody you're near. So the analogy that I use is smoking. You know, we know smoking isn't healthy, but if you want to do it, that is your right. Except you can't smoke in most restaurants, you can't smoke on an airplane, there's a lot of places you can't smoke. Well, that's because secondhand smoke harms other people. The same is true for mask wearing. It's not going to protect you, but it's going to protect you from getting somebody else sick. And now, 10 weeks into this, and more than 10 weeks, if you look at the global experience, the data is in. Mask wearing really works. And it particularly works if everyone in proximity to one another wears a mask. If one person does it, it's good. If everyone does it, it is very, very effective. So that's why we're going to continue to push the face cloth covering. Throughout this crisis, I have said, please be kind, please look out for your neighbors. This is the best example of that. This is the best example of that. Do your best to prevent someone you know, or someone you work with, or someone you near, or someone you love from getting sick. Dr. Alexander Scott can go into the science of it, but the bottom line is that this disease is primarily spread when droplets from one person go to somebody else. Sneezing, coughing, talking, singing. And so if you have your mask on, it substantially reduces that risk, substantial. Relatedly, we also know that outside is safer. Thankfully, that coincides with the weather, and it's why we're encouraging folks to eat dinner outside if you can, be outside, keep the windows open. Being outside often makes it easier to social distance. Again, we really want to be avoiding being inside in close proximity to one another. By the way, if you find yourself, I'm going to keep saying this because I'm trying to make the rules simple to follow. If you find yourself anywhere, in the grocery store, at a shop, at a backyard barbecue, at church, close to people who aren't in your family, get away from them. You're doing something wrong. You don't have to remember a lot of rules. You have to remember mask wearing and just try to keep your distance from people. In any event, a new study shows that the droplets we expel when we talk can hang in the air for up to 8 minutes. So the longer we're inside without good air circulation, the more likely it is that the droplets could infect people who are near us, even if we're practicing proper social distancing. On the other hand, if we're in outside space where there's constantly circulating with wind and fresh air, it can carry the droplets away and disperse into the air and substantially reduce the chance of infection through inhalation. So being outside is good. It's good for your mental health. It helps you to stay away from folks. But now the science is very clear. You're also much less likely to get infected when you're outside. So we want to encourage folks to spend time outside. Okay, I want to say a few more things on different topics. Distance learning. Summer is coming. This is the hardest time of year to keep kids focused anyway. You know, the sun comes out, the weather gets warm, spring fever sets in, and it's hard to keep the kids focused. We have to. They have a few more weeks of school, and we have to really, really put our back into it now to enable these kids to get as much learning as possible for these remaining weeks. And by the way, I know that's hard. Teachers are tired, kids are tired, parents are tired. It's been dragging on longer than any of us had hoped. The facts are we are still doing a good job with distance learning. Now, it's getting harder every day, but still we have 90+% participation rate. Teachers are continuing to be innovative. Students are continuing to push themselves to engage. And I appreciate that. I do appreciate that from all of you. Now we have to double down on our creativity. I'm asking you to put in one last push. Don't throw in the towel. Please do not just throw in the towel for these last few weeks of school. I know some of you have canceled exams for the high schoolers, and that's fine, but please find other ways, projects, engagement, papers, to keep these kids engaged. They deserve it, and there's just a few weeks to go, and I'm asking you to hang in there and put in a final push and run through the tape at the end of the year. By the way, many teachers are in fact doing this. In Jamestown and at the Rhode Island School for the Deaf, the teachers have been doing teacher car parades where they drive by students' houses with permission, just to say hello from a safe distance. I think that's fantastic. It's a way to maintain connection with your students. So if you're not doing that, maybe that's something you could consider. Just, it's so valuable for these kids to actually see their teacher, see that smile in person. So thank you for that innovation. Teachers in North Providence have been leading Spirit Days to keep their kids engaged in distance learning. I hear that's going very well, and it is keeping the kids engaged, so thank you. In Little Compton, educators put on a virtual talent show for their students. I think that's fantastic, thank you. And teachers throughout schools in Providence have been sharing their best practices with other educators just to keep the creativity flowing. These are just a handful of examples. I've read through many of them. I chose to highlight a few, but the bottom line is this. This is unprecedented. And we want kids to be able to go back to school in the fall in their classrooms. But what we've been living through for the past couple of months, no one's ever done before. There's no rule book to follow, and it has been hard. And you've done a great job. 98%, of students engaged. Most students, nearly every student having Wi-Fi. Teachers coming up every day with more creative ways to do it. Please just ask yourself today, if you're a parent, if you're a teacher, if you're a principal, if you're a student, ask yourself, what can I do to really get the most out of these last couple of weeks? How can I change what I'm doing? How can I have a little more energy? How can I engage a little bit more? Let's finish strong together. We started this together. We were the first state in the country to do this. We are among the most successful states with distance learning. Let's finish what we started together and then go off and have an amazing, fun summer. Finally, I also want to take a moment today to honor National Foster Care Month. I'm joined here today with Secretary Wilmazetta Jones. National Foster Care Month is celebrated every May, and it's to recognize and thank our foster parents throughout Rhode Island who have opened their homes and their hearts and welcomed these amazing, wonderful kids into their families. Today in Rhode Island, we have almost 1,600 foster care children in loving homes, 200 of whom were placed just this past year. That's fantastic. We've made a huge effort in the past 24 months to increase the number of foster families and children we could place into foster families. Every kid deserves the opportunity to live in a loving family, in a home with a loving family. So I want to say thank you to the foster parents who are out there. Thank you for doing this. This time has been filled with anxiety, financial hardship, difficulty, mental illness for everyone. That is often especially true for those of you who have taken in a foster child or two. Additional burdens and trauma right now. Because of you, because of your love, because of your generosity, these kids are better off. And I want to thank you for doing that. And I wanted to today just take a moment to recognize May as Foster Parent Month and to thank you for what you're doing to make Rhode Island stronger. I also want to take a minute to reach out to everyone in Rhode Island to ask if you might consider becoming a foster parent. We need you. These kids need you. We know it works. And now more than ever, we could use your help. If you're at all interested in what I'm saying, if it's at all intriguing to you, if you think you might have just a little space in your family, in your home, in your heart to give life to a youngster, I want you to visit the DCYF website, dcyf.ri.gov, and just learn about it. Learn about what it is like to be a foster parent. We are making it easier to become certified. We're making it easier for the whole process. And I'd just like to ask you to think about it because we have a need. And I know there's a lot of you out there who have a lot of love to give. Finally, we have a lot of work to do this week to get ready for the June 1st phase 2. Hopefully you've seen over the weekend, we worked really hard to get everything up, get most everything up online on the website. So there are specific detailed guidelines for restaurants, salons, gyms, offices, churches, synagogues, houses of worship. We're going to continue to update that this week, but I would encourage everybody to go online and check out those details. I hope they are helpful for you. Take this week to get yourselves organized, figure out what your business needs, and let us know if we can help you. 521-HELP is the Commerce website. 521-HELP. Go to the Commerce website. Call Commerce. Reopeningri.com. We want to do everything we can to help you get your business open. To that point, this week, Commerce is putting together and is hosting a series of Facebook town halls for specific business owners. These town halls have been a fantastic way for us to hear for the community. We had one for hairdressers and barbers, and thousands of people called in. So this week, Commerce is hosting specific sessions for business, general businesses and offices, one for gyms, one for restaurants, and one for personal services. You could go to the Commerce Facebook page to see a complete listing of these events and these times. I would encourage you to do that. You know, if you're a business owner who's anxious to get back to business next week, and I would encourage you to do that, figure out when the town hall is for your business, and if you can, tune in. It'll help us get it right. If we hear from you, it'll help us get it right. And I think it'll help you. We've heard from a lot of businesses like, oh, that helped me a lot to learn how I can get back into business. So I'm going to turn it over to Dr. Nicole and then come back for questions.
Thank you, Governor. Good morning, everyone. Thank you for joining us. I want to echo several of the governor's sentiments. First, to all of the businesses out there, Rhode Island Department of Health, Commerce, so many across state government have been working hard to be able to prepare for you the specific detailed guidance that you'll see coming up over the next 24 to 48 hours so that you know what you'll need to do. We want to be here to support you as the economy reopens. I also want to relay a huge thank you to teachers throughout the state, as well as to the foster families that the governor spoke of. I often talk about health equity, we all do, and about how we need to get at community level factors, because those factors are what have the greatest impact on health outcomes. We talk a lot about health care, but when we say health, we're not just talking about what's going on in the doctor's office. Health starts in our communities. It starts with the foster families that we are expressing appreciation for. It starts with the kind of food we have access to. It starts with the employment opportunities we have access to, and it starts with our schools. Teachers and other school personnel have an enormous role to play in building healthy communities. We need to keep thanking them, supporting them, and partnering with them to ensure that all children bounce forward from COVID-19 academically and keep growing, learning, and progressing. In terms of our COVID-19 data, our number of new positive cases are on the low side today. We have 73 new positive cases to report, and we had 79 new positive cases that would have been reported yesterday. These numbers are on the lower side because of the holiday. With the Twin River site being closed and other sites being slower, we expected a drop in these numbers. Our numbers of people who are currently hospitalized has remained steady. We have 226 people currently hospitalized at this point. We had 224 people currently hospitalized for yesterday. Of the people who are currently hospitalized, the 226, 50 are in the intensive care unit, and 36 of those 50 are on a ventilator. These numbers for people in the ICU and on ventilators are both roughly half of where they were a few weeks ago. This is definitely an important sign for us to continue to monitor. However, it is very important that we do not get complacent. What we are in is a marathon, not a sprint. COVID-19 is going to be part of our lives for some time. So as we go forward, we want to make sure we continue to adopt the social norm changes that we know are critical to helping us crush COVID. Generally, Rhode Islanders have done a very good job following the governor's guidance and following the public health guidance that we have been sharing, but the landscape statewide can change very quickly. We've known to have additional focus on our communities that are disproportionately impacted to make sure that they have the resources needed. And it is going to be so important for us to embrace the new set of social norms to prevent the spread of viruses throughout the state. As we have been saying, this means continuing to keep our groups consistent and small, continue to wear our masks when out in public, continue to wash our hands thoroughly and frequently, and most importantly, staying home if you're sick. We continue to repeat these measures because these prevention measures work. They are critical at every phase of this pandemic, especially now. In terms of the fatalities, we have 13 new COVID-19 associated fatalities to report today, unfortunately. One person was in their 60s, 4 people were in their 70s, 3 people were in their 80s, and 5 people were in their 90s. Although we did not post a data update online yesterday, we also had 13 new COVID-19 associated fatalities confirmed yesterday. That means that our cumulative total increased by 26 since our last data update. Our thoughts and prayers are with the families and loved ones of these Rhode Islanders we have lost. I'm going to finish with echoing the governor's point about wearing masks. It is a truly effective way to help prevent the spread of viruses. Continue to think about the fact that you wearing a mask means that you're telling the Rhode Islanders around you that you care, that you want to help protect them from getting exposed. 2 final things that are key is, even though you are wearing a mask, it is important to continue to not to go out into public if you are sick. It is critical to continue to stay home. The second thing that's key is the mask, as we've learned more about this virus, is effective at helping someone that does not have symptoms but may have COVID-19, even if they're not aware. It helps prevent them from spreading it to the next person. So please continue to engage with us in doing that, helping to make the difference that we know is critical. And with that, we'll get started with questions. Thank you.
Governor, I think a lot of businesses who are set to reopen in phase 2 were hoping for more specifics today, particularly salons. Can people do facials? Are they allowed to blow dry? Are you saying those guidelines are not going to be available until later in the week?
Are they not online now?
No.
When are the hairdressers going to be online? Okay, so, excuse me. A number of, as I said, we spent the weekend getting online as much as we could. And there is a lot online now for restaurants, houses of worship. We want to have one more town hall with the gyms. We want to get a little bit more feedback. So we're going to have one with the gyms and give us like another day or 2 for the salons and the barbers.
You mentioned the gyms right there. Are you sure whether or not yet masks are going to be needed inside of a gym?
That's what they're figuring out. So, no, I am not sure. Some gym owners really want to do that. Others feel that they can do a good job keeping people sufficiently far apart. So what we're trying to do is strike a balance between keeping everybody safe, but not giving businesses such a rigid set of rules that'll be hard for them to follow. So if I could just ask for another day or 2 we'll have more details online.
And just following up with that, you mentioned that a lot of these decisions are made in coordination with our neighboring states when it comes to opening certain sectors. Do you know that Massachusetts or Connecticut will be opening their gyms anytime soon, based on your reopening?
I don't know where they are with gyms. It's funny, I spoke this morning with Governor Baker on various things. I think he said they're a couple weeks away from indoor dining. But I don't know where they are with gyms.
Governor, the lower case numbers over the past couple of days, does that surprise you given that we're now just a little over 2 weeks out from lifting the stay-at-home order? Would you have thought there would have been a spike since that was 2 weeks ago? What do the case numbers tell you? What are you seeing?
So let me say a few things. I'm very pleased with the numbers. I do want us to realize we tested 1,300 people yesterday. How many people? Roughly, less than 1,500 people. During the week, last week, we were up to 3,000 a day. So it's excellent news. It's a plateau, but I don't think we should get too excited when we hear 70 something because we tested many fewer people. I feel good about it, right? Like, I'm really pleased that we reopened on May 8th, and now this is the data. This is data today and yesterday that we're observing, which is showing us if we were going to have a problem, because we started reopening 2 weeks ago, we would start to see that today, yesterday, the day before, today, and tomorrow, and we're not. So is that your question? So that's a really good thing.
If I could just follow up with Dr. Alexander Scott, could you just update us on the number of nursing home fatalities? And with these smaller case numbers, are you seeing any trends? I know I've asked this before about where they are. Are there pockets of cases? Is it certain kind of workers? Is it mostly healthcare workers? Can you just update us on the trends you're seeing?
Yes. Of the 13 fatalities we announced today, 5 were associated with long-term care facilities. Among our unfortunate deaths, through the end of last week, roughly 440 of our fatalities were associated with long-term care facilities, and roughly 20 have been associated with assisted living facilities. In terms of the data that we are seeing, we are really focusing on places where we may see a cluster and reacting quickly, particularly within our communities of color. We've talked about the fact that we have had a progressive, comprehensive response with congregate care settings, going in quickly, being able to address infection control concerns, make sure there's adequate PPE, get the testing done. We're continuing to do that across the board. So where we were seeing clusters earlier on in our manufacturing companies, we have not continued to see that because the public health measures that we've taken have been effective, ensuring effective infection control measures, making sure we identify people who may have been positive, get them isolated, and speak to their contacts and get them quarantined. We know that these measures work, so we're continuing to do that if we see a cluster within a housing development or a business, working very closely with employers, continue to encourage businesses to have their COVID-19 control plan. That's a way to really help employees and customers feel confident and feel safe, knowing that those types of plans are in place and seeing that those types of plans are effective in helping to quell clusters of cases that exist. Does that answer your question?
Yeah, I guess among the positives, are you still seeing just a high percentage in some of the urban areas and some of those areas that you were seeing before? Have there been any other kind of sporadic things, or is it just kind of a random scattering of people all around?
No, we are definitely still focused on our higher density communities. Central Falls has 26% positive. Providence has 22% positive. North Providence has 18% positive. Pawtucket and Woonsocket both have 17% positive. That's our priority for really being aggressive and comprehensive and focusing on getting those percent positives down while we continue to expand testing and make sure we're capturing as much of those communities as we can.
Just to follow up on that, I believe the zip code data hasn't been updated since May 4th. Is that something that's just not being posted to the public-facing page? It's something you're still tracking, I assume?
It's definitely something we're tracking and working to update. As we were doing the data migration, we were bringing the data back slowly, starting with cities and towns and working to the zip codes.
Director Jones, I know over the weekend you had, I guess, an email that was sent out to some community groups expanding the Equity Council to include some additional members. We're hearing a lot right now, essentially two completely different narratives. In some sectors, there's this almost desire to pause reopening based particularly in the communities represented by the Equity Council. On the other hand, we've got people who are putting out jingles saying that we should be opening up, give us our summer back, and so on and so forth. How do we marry these two completely opposite narratives right now?
In my opinion, the way that we marry those two completely different narratives at times is to ensure that we have community at each and every table, and each and every forum, giving us insight and input on how best to do each opening phase. And with the Equity Council, we have that opportunity. As you mentioned, all of our communities of color are represented on that council, and it's an action-oriented, action-focused council, not one where we just sit and talk and we do nothing next, but it's action-oriented, and that action includes the community on each of those pieces of work.
Governor? Yeah, sure.
I want to answer that and tie in something Brian was asking about, because this is what's on my mind now. This is what we have to really keep our eye on, which is communities or settings where we are very definitely still not out of the woods. I mean, the CDC says you want to be at less than 10% positive. And we just heard that in certain areas of Providence, Central Falls, Woonsocket, North Providence, we're not there. We're at twice that. So if you were to say to me, you know, what am I worried about? We're spending an enormous amount of time right now getting the new rules and regulations out by sector. And I hear you, Kim, we got to pick up the pace. But we're trying to get it right, talking to businesses. But then we have our eye on these communities where the positive rate is still stubbornly high, which means we have to do more testing. We need to get more folks to come out to test. We need to do a better job of educating, public education. And that's why the work Mama Zed is doing is so important. But someone asked this question, you know, I had a call Friday with faith-based leaders, and some of them were saying to me, Governor, we respect your decision to go to 25%, but we're just not ready. And I said, that's fine. You have to do what you think is right for your community. So if I were a pastor in Central Falls or certain parts of Providence or Woonsocket or one of these communities that's deep, has high, I might think twice. And I might impose stricter regulations in light of what's going on in that community. You know, I think you see Newport now is thinking of doing their own ordinance to require people to wear masks. You know, I have to respect that. They must have reason to believe that in Newport, in the tourist season, there's gonna be lots of people, out-of-towners, that's the way to go. So it's important because this is the way we're gonna go for the next year. We're at a pretty stable place overall, but we will get into trouble if we don't keep our eye on communities where we think that we have issue. That has been the story of every country. They lose sight of a mini outbreak. And so that's what we're not gonna let happen in Rhode Island. And because we won't let it happen, that's why we have so much testing and so much contact tracing, and we have an Equity Council because we wanna, you know, keep a lid on the virus everywhere.
Governor,
Sorry, I cut him off.
No, sorry, Governor, I'm hearing from teachers from all around the state that say they feel that as a reward for their hard work, innovation, and creativity in distance learning, that they're facing layoffs and program cuts, and even essential subjects like math and English are on the table in some communities.
Yeah.
So what do you say to them?
So I don't know which communities they're talking talking about. I'm not aware of that. I talk to the mayors often, and I don't know of anyone planning that. So here's what I would say. First of all, they deserve our gratitude. I mean, it's amazing what teachers have done. They've moved on a dime to embrace distance learning without ever having done it before. They're working harder than they were before, and they're doing a great job. So I want to be crystal clear about how grateful and impressed I am with educators. Look, here's the brutal reality. If we don't get further federal stimulus from Congress, I can't even imagine how horrible it's going to be to balance these budgets. And I have towed the line on furloughs as long as possible. As I've said, I've been crystal clear. I view these things to be last resorts. That's especially true for teachers. But if we don't get more money from Congress, like everything's on the table. And now my view would be that's a last resort. But I want to be very clear with people. An $800 million deficit is like nothing the state's ever seen before. And the choices we'll have to make will just be unprecedented.
Are we going to hear more about rental assistance this week?
Yes. When? Tuesday? What today is Tuesday? Wednesday or Thursday?
All right, thank you.
Governor, we saw the photo of you and the first gentleman experienced outside dining on Friday. Could you just take us through the experience? Did anything happen that maybe change your perspective or shape your perspective on it?
Thank you for asking. We had a great time. And I would encourage people to go out. You know, if you're lucky enough to be able to afford going out for dinner, do it. It was great. It was, it's different. The waitress has a mask on. This particular restaurant did a really good job. There were signs everywhere around what is social distancing. Don't come in if you're sick. They figured out a way to have touchless ordering. I noticed the waitress, if patrons got up from their table to go to the restroom without their masks, the waitresses were very kindly and respectfully asking them, hey, could you please put your mask on? And people complied. So where we were, a lot of people were out. It was excellent. And frankly, it felt nice to kind of be normal again. So it was good.
You provide your information to the restaurant?
Yes, we did. We did ahead of time. Yeah, we had to make the reservation.
How is that going with the state collecting the information?
Fine. Yeah, Pete, you want to say something? Yeah, people are complying.
It's a very helpful tool, as we know that having the information similar to the app, being able to talk about where you have been is helpful. What we are doing is only using the information for a brief period of time if your name is collected from going to a restaurant. I also went out with our family to enjoy dinner outside, provided our name and information, and it's something that we encourage to those who are able to do it.
Continue in phase 2 that you give your information?
Mm-hmm.
Yes.
I did get an email from a mother, Dr. Scott, that the server now, her daughter, I guess, provided her cell phone, and now the server keeps texting her. They think they saw him drive by the house. There's some people that feel a security element of giving their address and phone number to a stranger.
I haven't heard that. That's certainly something we would want to be aware of and address in any situation, whether, where you're engaging in that type of information. I can be clear that the restaurant information that's held is kept secure, and certainly we want to work with the restaurant to help make sure that that's complied with and maintained from that standpoint.
Has the health department accessed or asked any restaurants for their information so far?
Only if there is a cluster of cases. I'm not at this point aware of any right now.
Governor, have you received any further guidance from the CDC on youth sports returning? Are you getting any closer to feeling more comfortable about them returning?
Thursday of this week, we're going to talk about youth sports. It's a big topic. It's, you see Major League Baseball hasn't even made their decisions. So, yeah, we're talking to the CDC, talking to other states, and on Thursday, I'm going to have more to say about it.
Raimindo.
Governor, there have been reports that on a national basis, different places, different areas are experiencing a very different virus. That in rural areas, out west, Midwest, and so on, are seeing really half or even fewer per capita cases than the Northeast, especially in hotspots like New York or Boston. Do you see any political polarization similar to that within Rhode Island? Because we know that Central Falls has a very different experience of the virus. Pawtucket has a very different experience of the virus than, say, West Greenwich or Exeter. And even within zip codes, I mean, 02906 has a very different experience than 02909. And these are associated with population density, the types of jobs people hold, whether they can work from home, and so on. But this seems to me to raise the question of polarization between people who just sort of don't get each other's experience.
Yeah.
And what do you see as the threat from that, the risk from that, and what can you do?
So it's a complicated question. You bring up something which is real. To me, it goes to equity, which is why we have a whole work stream around equity and why Secretary Jones or someone on her team is in every one of our phone calls. Like she says, equity has to be at every table, the testing table, the contact tracing, public health, the economy, et cetera. It is an issue, right? Now, let me say a few things. The virus is everywhere. We've seen issues in Burrillville, in Smithfield. It's everywhere, which is to say those are suburbs or more or rural places. Having said that, it thrives in density. We know that. It thrives in density. Rhode Island is the most or second most densely populated state in the country. That makes this a lot harder. And the places you reference, Central Falls, 02909, these are densely populated areas. And so the experience you have in a densely populated part of Woonsocket or Providence is different than South County. Having said that, it's in everyone's interest to prevent outbreaks, to prevent a spread, and to prevent a resurgence. So just because you might live in a community which is less dense and less affected, doesn't mean you can go out without your mask, doesn't mean you can break the rules, doesn't mean you can not care about what's happening in these other communities. First of all, you should care about it because basic human decency is that we're all connected. But the reality is, every other country who's gotten into trouble, there was an outbreak in one community, which led to a shutdown of the whole state. So we really are, it's what I keep saying, you cannot fight this thing. You can't try to outsmart it, you can't try to outrun it. Our state will all be better off if everybody follows the rules. And the us versus them is never helpful, but it's really not helpful right now because there is no us versus them. Because if I have to shut down our economy again, it's our whole economy, and I don't want to do that. So I would urge, it's just like wearing a mask. You don't do it for yourself, you do it for your neighbor or whoever's around you. So I think that look, it's my hope that we pull through coronavirus stronger than we went into it, more unified as a community. And I think you do that by keeping your eye focused on issues of equity, which is why we're trying really hard to get everyone tested, even if you're poor, even if you're in an inner city, even if you're an undocumented immigrant. But look, you're right.
Governor,
Last question.
obviously you talk about the importance of mask wearing right now, and we're all wearing masks and we're all required to answer questions before we came in here. But Mayor Ryan Walsh talked about extending social distancing guidelines that we're doing right now for another 6 to 8 months. Do you have any envisioning of a future where we don't have to wear masks and these restrictions that we're in right now, we could loosen them up a little bit?
It's impossible to say. I mean, yes, I do. Of course I do. The question is when. The question is when. So if there's a more effective therapeutic, if certainly when there's a vaccine, if we were to get to a place where, you have some kind of widespread immunity in the population, but I don't see it happening in the next 5 or 6 months. I think this social distancing, hand washing, mask wearing. Certainly when we reopen school, what I tried to convey in my comments today was as we do more, go back to school, go back to college, go back to work, go back to the beach, actually we have to follow the rules even more. So I think that we should just assume it's here to stay for months and try to figure out ways to live with the new rules.
Thank you, everyone.
Thank you.